Cameron here, registered physiotherapist. Today I'd like to talk to you about the differences in terms of how some patients can present when they have a nerve compression in the lower back, like a nerve root compression, which is creating peripheral symptoms, and essentially how to decide on what treatment approach would be most beneficial for the patient. So in a lot of cases, when I'm seeing somebody who has sciatica, right, what I'm looking to achieve is to find out what specific positions or movements or activities make their leg pain or their peripheral symptoms worse, and what symptoms or positions, what positions or movements or activities centralizes their pain. So what I mean by that is, what, if repeated, what specific position would make the symptoms travel up the leg and into the source of their problem, which is actually their lower back. So in a lot of cases, there's two very, very common conditions in which somebody might be experiencing numbness down the leg. One is if there's potentially some kind of disc involvement. So what this basically refers to is between the vertebrae we have these discs, and they act as shock absorbers. And essentially what can happen with these discs is we can get a little bit of the material protruding outwards from the disc, so a little bit of a herniated disc, so to speak, which can put pressure on a nerve root and then cause symptoms down the leg. Another really, really common situation in which people will get symptoms down the leg is with an individual who has degenerative disc disease, which is essentially arthritis in the disc. So as we age, right, the space between these different vertebrae where nerve roots come out, the disc space, so to speak, gets smaller. This is just from natural wear and tear. And based on, as I mentioned, based on whether it's more of, let's say, a disc or an arthritis, the different positions or movements that create the leg symptoms typically are different. So not in all cases, but in a lot of cases with let's call it a disc issue, extensions in a lot of cases will actually improve symptoms. And what I mean by that is the leg symptoms will start to centralize and go into the lower back. And in a lot of cases with individuals who have arthritis in the back, flexion type of movements in a lot of cases will actually improve those symptoms. So with your typical disc, one exercise that I will typically give a patient, again, if extensions are centralizing their pain, is I'll have them go on their stomach like this and basically repeat lower back extension. So almost like a sloppy push-up that you keep repeating. Now what I'm looking for when I have a patient do these symptoms or do this exercise is I'm looking for where their symptoms go. So again, ideally, we're hoping that the leg symptoms start to go up the leg and start to move towards the back area. So we're looking for a centralization. Now, if the patient is doing this particular exercise and their symptoms are actually traveling further down the leg, that's actually a red light. That would be, we want to stop, we don't want to continue that. So the exercise is only to be continued if the leg symptoms are centralizing and if the symptoms are moving towards the back. So again, that would be your typical disc. On the other hand, with a lower back that might have some arthritis, again, typically we're looking to actually do the opposite of that particular movement. So in a lot of cases, that particular extension activity or even just standing for those individuals will actually make their leg symptoms worse. So we wouldn't want them to do those extension exercises. For that particular patient, typically what I'll have them do, so I get them on their back, and then we repeat knees up towards chest. And again, I'm looking for the exact same thing. So as they're repeating, bringing the knees up towards the chest, well, what's happening to the leg symptoms? What we're looking for is a centralization of their pain and a reduction of leg symptoms. Thanks again for watching. And please make sure to check with a physiotherapist to make sure that these exercises are appropriate for you. And if you find these videos educational, if you find them amusing, please feel free to subscribe below. Have a great day. Take care.